The role of therapy and counseling in mental well-being. Introduction. Why therapy matters. Mental health is just as important as physical health, yet many people hesitate to seek professional help when they need it. Therapy and counseling play a crucial role in maintaining mental well-being, offering people a safe space to discuss their emotions, process their experiences, and develop healthier coping strategies. While some view therapy as only for those with severe mental illness, the truth is that everyone can benefit from talking to a trained professional. Whether it's dealing with stress, relationship issues, past trauma, or personal growth, therapy provides valuable tools to navigate life. In this discussion, we will explore the difference between therapy and counseling, how therapy benefits mental well-being, different types of therapy and their approaches, how to find the right therapist for you. By the end, you'll have a clear understanding of how therapy can positively impact your life and why seeking help is a sign of strength, not weakness. 1. What is therapy and counseling? Many people use the terms therapy and counseling interchangeably, but there are key differences between them. Small blue diamond counseling, usually short-term and focused on specific issues, such as stress management, grief, relationship conflicts, or career decisions. Counselors help clients identify problems and find solutions in a structured way. Small blue diamond therapy, psychotherapy, a longer-term process that dives deeper into mental health struggles, emotional challenges, and past traumas. Therapy aims to change thought patterns, behaviors, and emotional responses over time. Both approaches provide support, but therapy is more in-depth and suitable for those facing complex mental health conditions like depression, anxiety disorders, PTSD, or personality disorders. Who provides therapy and counseling? Psychologists, specialists in mental health who provide therapy but do not prescribe medication. Psychiatrists, medical doctors who can diagnose mental health conditions and prescribe medication, often in combination with therapy. Licensed therapists, LCSW, LMFT, LPC, etc. Professionals trained in various therapy techniques to help individuals, couples, or families. Counselors, often focused on specific life challenges, such as addiction counseling, school counseling, or career counseling. Regardless of the title, the goal is the same: to help people lead healthier, happier lives. 2. How therapy improves mental well-being. Therapy is a powerful tool that improves mental well-being in several ways. Let's break down its key benefits. Keycap 1 provides emotional support. One of the biggest advantages of therapy is that it offers a safe and non-judgmental space to express thoughts and emotions. Many people feel isolated in their struggles, and having a therapist listen with empathy can be incredibly validating. Keycap 2 helps with stress, anxiety, and depression. Therapists use evidence-based techniques to reduce stress and manage anxiety or depression. For example, cognitive behavioral therapy, CBT, helps individuals reframe negative thoughts and build healthier thinking patterns. Mindfulness-based therapy teaches relaxation techniques to manage stress and anxiety. Keycap 3 strengthens relationships. Whether it's couples therapy, family therapy, or individual therapy, learning communication skills enhances relationships. Therapy helps people navigate conflicts, set boundaries, and understand emotional needs in healthier ways. Keycap 4 increases self-awareness. Many people go through life reacting to situations without understanding why. Therapy encourages self-reflection and helps individuals identify patterns in their thoughts, emotions, and behaviors. Keycap 5 provides coping strategies for life's challenges. From grief and trauma to career stress and self-esteem issues, therapy provides practical tools to handle difficult situations. Instead of feeling overwhelmed, individuals learn to cope in healthy ways. Keycap 6 helps with personal growth. Therapy isn't just about treating mental illness, it's also a tool for personal development. Many people seek therapy to improve self-confidence, work through life transitions, set and achieve personal goals. The goal of therapy isn't just to survive, but to thrive. 3. Different types of therapy and how they work. There are many different approaches to therapy, and finding the right one depends on your needs. Here are some of the most common types. Keycap 1 Cognitive Behavioral Therapy, CBT. White heavy checkmark best for anxiety, depression, PTSD, phobias. White heavy checkmark focus. identifying and changing negative thought patterns. White heavy checkmark example. A therapist helps someone with anxiety recognize irrational fears and develop healthier responses. Keycap 2 Psychodynamic therapy. White heavy checkmark best for trauma, deep-seated emotional struggles. White heavy checkmark focus, exploring past experiences and unconscious thoughts. White heavy checkmark example. A person with abandonment issues might work with a therapist to understand how childhood experiences shaped their fears. Keycap 3 Humanistic therapy, person-centered therapy. White heavy checkmark best for self-esteem issues, self-discovery. White heavy checkmark focus, encouraging self-growth and reaching full potential. White heavy checkmark example. The therapist helps clients explore their personal values and find fulfillment in life. Keycap 4 Mindfulness-based therapy. White heavy checkmark best for stress, anxiety, emotional regulation. White heavy checkmark focus, teaching relaxation, mindfulness, and acceptance. White heavy checkmark example. Clients learn meditation techniques to manage stress and emotional distress. Keycap 5 Couples and family therapy. White heavy checkmark best for relationship issues, family conflicts. White heavy checkmark focus, improving communication and conflict resolution. White heavy checkmark example. A couple struggling with trust issues works with a therapist to rebuild emotional intimacy. 4. How to find the right therapist. Finding the right therapist is a personal journey, but here are some practical steps to guide you. Step 1. Identify your needs. Do you need help with stress, relationships, trauma, or mental illness? Are you looking for short-term solutions, counseling, or long-term emotional work, therapy? Step 2. Research therapists. Look for licensed professionals with experience in your area of concern. Use platforms like Psychology Today, BetterHelp, or local mental health directories. Consider therapists who offer online sessions if in-person isn't accessible. Step 3. Consider affordability and accessibility. Check if therapy is covered by insurance or if the therapist offers sliding scale fees. Many nonprofits and universities offer free or low-cost counseling services. Step 4. Have a trial session. The first session is about assessing compatibility. Ask yourself, do I feel comfortable with this person? Do I feel heard? It's okay to switch therapists if it's not the right fit. Conclusion: therapy is for everyone. Therapy and counseling are powerful tools that help people heal, grow, and live more fulfilling lives. Whether you're dealing with stress, anxiety, trauma, or just want to improve yourself, seeking professional help is one of the best investments in your well-being. If you're thinking about therapy but feel unsure, remember, asking for help is a sign of strength, not weakness. Final thoughts and call to action. Speech Balloon: what are your thoughts on therapy? Have you ever tried it? Share your experiences in the comments. Pushpin: if you found this discussion helpful, don't forget to like, subscribe, and hit the notification bell for more mental health content. Brain: take care of your mind. It's just as important as your body. Red Heart: would you like me to refine any part or add something specific? Smiling face with smiling eyes: